Ladies and gentlemen, if there has ever been a clearer picture of how many freedoms you will lose and how fast you will lose those freedoms, all you have to do is look what the government has done with the coronavirus. They dictate where you can go, when you can go, what you have to wear, what you can buy, what you can't buy. You are completely controlled by the government, and they are using emergency powers based on a coronavirus. This is a snapshot of what socialized medicine looks like. Please pay attention. Good afternoon, ladies and gentlemen. We sure live in a topsy-turvy world today with everything going on, rioting in the streets, coronavirus. You've got school shutdowns. You've got governors telling you what you can and cannot do. It's really, really crazy. There's a lot going on, and this has certainly caught our attention. One of the things that caught my attention back in 2019 was Obamacare and what was going on with medical care in the United States today. What I have done is I've researched this for the last 10 years. I have contacted every professional I was able to contact, and even went so far as to go to medical conferences to find out what was going on with medical. I've got books on it. I got all kinds of books on it. I got papers on it. I got books here, not counting a computer database full of information about medical and medical care and what is going on. What I've tried to do is put together a half-an-hour presentation on what I call medical realities. I've had to leave an awful lot of stuff out because obviously I have so much information I could give a week's seminar on it. So what I tried to do is be very relevant and very up-to-date. So what is to follow is medical realities. What is really going on in medical today? Reality. Everyone must have health care. That's a reality. Someone must pay for it. That's also a reality. Too many Americans equate health insurance with health care. Health insurance is not health care. Health insurance may or may not pay for the health care your doctor recommends. Too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. There are not enough doctors. The situation is getting worse, not better. Every person has their own horror story. Long waits for an appointment. Doctors no longer in your network. Co-pays unaffordable. Doctor does not accept new patients on Medicare, and this is very common. The only real question is, how do we deal with these realities? Well, I could be like a politician and tell you what you want to hear all the time, kicking the can down the road. But the truth is, ladies and gentlemen, we are at a crossroads. We are at a very important crossroads. Medical care in the United States is going to go completely socialized medicine or return to personal responsibility for your own medical care. I see no way to marry or combine the two. It's going to be one way or the other. Where are we now? One step away from socialized medicine. Congressional Democrats are pushing their universal health care agenda. The lead vehicle is Vermont Senator Bernie Sanders' Senate Bill 1129, billed as Medicare for All. Here it is, Medicare for All. But in reality, it's Medicare for no one. It's straight socialized medicine. House bill is very similar to the Senate bill. The presumptive nominee of the Democratic Party and the man behind the scenes have signed on. Joe Biden has completely signed on to socialized medicine. In fact, Joe Biden has pretty much signed on to everything Bernie Sanders wants. The bill would create a government monopoly on health care. The important word here is monopoly. No choice. It would outlaw all private health insurance, including Americans' job-based coverage. Most Americans get their health insurance through the corp companies they work for. That would be against the law. Here's another thing that's against the law. Impose restrictions on private medical practice. It would be illegal for you to go to a doctor and pay him directly. Can you imagine that? A person would simply have no choices. None. How did we get here? Well, in 1966 we had Medicare. In 1982 we had Medicaid, which was greatly expanded under Obamacare. In 1997 we had the Children's Health Insurance Program, commonly called CHIP. In 2010, Obamacare, which is still the law of the land. Make no mistakes, ladies and gentlemen, just because the tax penalty is eliminated, it did not eliminate the law. It is still very much in effect. If your company wants to provide medical coverage for you, they must get an Obamacare compliant health plan, which is loaded with things that most people don't want or need and is very expensive. Let's take a moment to discuss Obamacare. Now, normally before you discuss something, you define it. This, ladies and gentlemen, is Obamacare, Public Law 111148. This is a 4-inch binder filled front to back with pages printed on both sides in number 10 font. As you can see, it takes 2 hands to hold this up. How in heaven's name do you define something like this? On the other hand, these are our founding documents, the Declaration of Independence and the Constitution of the United States. And as you can see, I can hold these up with 2 fingers. The Declaration of Independence defines human rights. The Constitution gives us a roadmap to guarantee those rights. Notice the emphasis on we the people. Did we the people, through our elected representatives, write Obamacare? Who actually wrote the health care law? Section after section of Public Law 111148 contains the wording, the Secretary shall. This phrase appears 1,444 times. So you would think that Catherine Sebelius, who appeared in front of the Senate to be confirmed as HHS, would have had a lot to do with writing the law. Now we know that it was actually Mr. Gruber who wrote the law, and Mr. Gruber thinks Americans are too stupid for the truth. So let me ask you a question. Did you ever see Mr. Gruber's name on a ballot anyplace? Did you see Mr. Gruber in front of the Senate being confirmed? No. Mr. Gruber reported to one man and one man only, Barack Obama. To put it very simply, Obamacare has made the average American citizen a serf. For those who are not familiar with the term, in the medieval days you had the nobility who reaped all the benefits and the serfs who did all the work. Today, the nobility are called the ruling class or elites. And just to have a little fun with it, my ruling class is Mitt Romney, Nancy Pelosi, and AOC. Someone much more eloquent than I explained it this way. What Obamacare has done, thanks to Chief Justice Roberts' Supreme Court decision, is reduce us all from free citizens to cowed subjects, whom the federal government can order around in our own personal lives, in defiance of the 10th Amendment and all the other protections of our freedom in the Constitution of the United States. Freedom's lost. Freedom of religion. The Department of Health and Human Services submitted a final rulemaking on the state health insurance exchanges that created yet another accounting shell game. one that could force private citizens to pay for coverage of elective abortions. Time out, ladies and gentlemen, time out. We do have a U.S. Constitution, and Amendment 1 clearly states, Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. Ladies and gentlemen, there are millions of United States citizens who hold strong religious beliefs against abortion. And they feel by being forced to pay for abortion through their tax dollars, they are being prohibited the free exercise thereof. To compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. Thomas Jefferson. Another freedom lost, privacy. Centralized computer records give the governments everyone's medical records. Everyone's. Your records will not be private. The language is not in the law. It is in the Federal Register, which has the force of law. The authority comes from HIPAA, which allows release of patient records without consent to other agencies for other activities necessary for the oversight of the health care system. And the irony of this is HIPAA was supposed to protect our medical record privacy. There are two things Americans consider their own business and nobody else's. Number one, the state of their physical health. Number two, the state of their financial health. But yet both of these records will be mixed in a database in Washington, D.C. that any government clerk can look at anytime they want to for other activities. You have no reasonable expectation of privacy regarding any communication of any data transmitted or stored on this information system. Now that's from the official medical website, but you will not find that statement on the homepage. You have to go to the source code to find it, but it's there. Don't believe it? The Wall Street Journal business section, January 21st, 2020. Tech firms get identifiable hospital data. Identifiable means your name's on it. Hospitals have granted Microsoft Corporation, IBM, and Amazon the ability to access identifiable patient information under deals to crunch millions of health records. The latest example of hospitals' growing influence in the data economy. In other words, the hospitals now are selling your data. Is there a chain of accountability? If so, who's accountable? The Internal Revenue Service? It is the IRS who will make sure all taxes are paid and will also determine who is eligible for taxpayer-financed subsidies. We all know how the IRS keeps their employees accountable. Any time anyone's situation changes, a raise, a new job, a move to another state, that person will be required to report it to the IRS for purposes of recalculating their eligibility. Bureaucrats in charge. Organization chart for Obamacare. This is just for Obamacare. Can you imagine what that's going to look like when the government controls every facet of medical care? Section 6301 establishes the Patient-Centered Outcomes Research Institute. Establishment. There is authorized to be established a nonprofit corporation to be known as the Patient-Centered Outcomes Research Institute, which is neither an agency nor establishment of the United States government. And that, ladies and gentlemen, is directly quoted from the law. Here is a copy filled with paragraphs using words like subpopulation, clinical effectiveness, etc. Revenue from surcharges on your healthcare policies in 2018 to fund the Patient Care Outcome Research Institute was $506,485,458. In other words, ladies and gentlemen, the Americans who have bought health plans or got them through their company paid an additional $506 million to fund an agency that is neither an agency nor establishment of the United States government. In other words, we're funding an agency that can do whatever it wants with absolutely no oversight. Quote from the official Democrat Party talking points on government-controlled health care. And I have them right here, ladies and gentlemen, and the cover letter is signed by Nancy Pelosi. Question. I have heard that under the health care law, there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. The official Democrat answer, there is no such panel. This is a blatant falsehood. Section 6301, Patient-Centered Outcomes Research Institute. It lacks the panache of the English system, which is NICE, National Institute for Health Care Excellence, whose motto is improving health and social care through evidence-based guidelines. Make no mistake, ladies and gentlemen, these two agencies have the exact same job: to determine quality adjusted value of life. George Orwell's 1984. Has fiction become reality? But no one has put this better than Ben Stein. Fathom the hypocrisy of a government that requires every citizen to prove they are insured. What? But not everyone must prove they are a citizen.
What's your name?
And now, any of those who refuse or are unable to prove they are citizens will receive free insurance paid for by those who are forced to buy insurance because they are citizens. Obamacare is like a cancer to Americans' freedoms. It must be cut out before it metastasizes into socialized medicine. Since we are one step away from socialized medicine, and the Democrat Socialist Party will make socialized medicine a key part of the 2020 presidential election, therefore, it is important to ask the question, who is in control?
Oh, really?
That is what should be keeping you awake at night. Who is in control?
Excuse me.
Let's take a look at what has happened in other countries that have socialized medicine. English National Health Service decided Charlie Gard, a 10-month-old, should die. Decided Alfie Evans, a 23-month-old, should die. Legal challenges by the parents failed. In effect, the courts ruled the parents had no rights. These children were property of the state. The dark side of Europe's happy baby statistics. Down syndrome babies aborted. England, 91%. Denmark, 98%. Iceland, 100%. Is it really possible that 100% of the women who were pregnant, whose babies tested positive for the Down syndrome gene, wanted their babies aborted? You can't get 100% of the people to agree on the weather outside. As reported by Association of American Physicians and Surgeons, progress in physician-assisted death. Netherlands, in 2017, 33 mentally ill Dutch patients were euthanized according to government statistics. Some had their organs harvested. Switzerland, the Supreme Court ruled that the mentally ill, let me say it again, that the mentally ill have a constitutional right to access death. There are many verified cases of the non-physically ill being assisted to kill themselves, including an elderly woman who wanted to die because she had lost her looks. Canada, a court has declared that the foreseeable death requirement for lethal injection is unconstitutionally restricted and discriminatory. Abortion and euthanasia are necessary steps by the ruling class in order to control who lives from who is born to when the elderly have a duty to die. Do you want a bureaucrat, any bureaucrat, making life and death decisions for you? Can't happen here. I hear that all the time. Article by Marilyn M. Singleton, MD, President of AAPS. Free medical care, a deal with the devil. With regard to medical care, all medical necessary health services with no premiums, deductibles, or copays from the cradle to the grave. Sounds pretty good. Sold. Frankly, given the direction so-called reproductive health is going, you may never make it to the cradle. And as you can see, political cartoonists have a way of getting to the heart of the matter. And with the current laser focus on hospice for all, you may get to your grave a little faster. Sometimes I just want to shout, pay attention to all the mergers in the medical industry. Big pharmacy buying health insurance companies. The growing number of minute clinics and pharmacies and superstores. Note Walmart, medical clinic. Go to Walmart for your medical. Walgreens, buying up a company and putting doctor's offices right next to their pharmacies. To all the states that have removed all restrictions on abortion. New Mexico is one of them, House Bill 51. Fortunately, it didn't pass this year, but there's always next year. And this basically removes all restrictions on abortion up to and including birth and after birth. In the last 4 years, there's been a 60% increase in physicians employed by hospitals. That is 165,000 physicians no longer in private practice. California, the Department of State Hospitals has promulgated a regulation requiring that involuntarily committed patients who become terminally ill be given access to assisted suicide despite their legal incompetence. As reported in Scientific American, Washington became the first state to allow human bodies to be composted. Can anybody say Soylent Green 2022? I didn't believe it. I didn't believe that this would happen. But I looked it up. Washington State, Bill 5001. Isn't it time we listen to what the doctors are saying? After all, doctors are essential to health care. Coercing physicians into a healthcare system that does not always allow them to practice medicine in the image of the Hippocratic Oath ultimately hurts patients. Marilyn M. Singleton, MD. Dr. Patrick Wagner expressed deep feelings in his article, Laid Bare. To experience the destruction of a very, very intimate and loving friendship that between myself and my patients is heartbreaking beyond description. The article goes on in depth, but you get the idea. Both of these doctors have retired. They will not practice medicine that is controlled by the government. Explanation of socialized medicine. Just exactly what is socialized medicine? Well, here's kind of a comical look at it, as you can see where the stethoscope is. But the article by Dr. Jeffrey Singer, this is a one-page article, was written in 2010, and it is the best description of socialized medicine I've ever read. And I want to read you just the middle paragraph. In other words, we are about to experience the two-tiered system that already exists in most parts of the world that provide universal coverage. Those who have the financial means will be able to get prompt, courteous, personalized, state-of-the-art health care from providers who consider themselves professionals. But the majority can expect long lines, mediocre and impersonal care from shift-working providers, subtle but definite rationing, and slowly deteriorating outcomes. This, ladies and gentlemen, is something we'd never ever like to see happen in this country. But unfortunately, it's already started. Watch out for the public option or the Medicaid buy-in. That is simply a backdoor to single payer. The federal government is the single payer. They will pay everything, i.e. the taxpayers. Government-run healthcare takes medical decisions away from patients. The faceless single payer calculates the value of your life based on benefits to society. The single payer determines what treatments are necessary and appropriate for you. Can you say quality adjusted value of life? Your medical care will be provided by younger, less experienced physicians, non-physicians, possibly no one. In what order is the money distributed? Some money will trickle down to those who help patients, but 40% or more may be siphoned off en route. The single payer pays administrators, rulemakers, compliance officers, auditors first, doctors second. And a lot of doctors call this rubber money because if all the paperwork isn't perfect, the government will demand their money back. Someone must pay for it. That's a reality. There is almost universal agreement that costs will be $32.6 trillion over 10 years. And here's the study right here, ladies and gentlemen. $32.6 trillion. This is over and above what the government now spends on medical care. Cost control. Single-payer system use rationing to control cost. NHS sharply restricts access to treatments, hip and knee replacement, cataract surgery, arthritis, diabetes. Kind of get the general age group of what's going on here? The Daily Mail, April 8, 2019. Thousands of elderly are losing their sight as NHS rations cataract surgery. Yet in the United States, you have companies competing for your business. January 3, 2018, the New York Times. Hardly a bastion of conservatism. Average emergency room wait in England was 12 hours before they are attended to. Think about that. You rush your grandfather to the hospital having a heart attack. He's in the emergency room for 12 hours before a doctor even sees him. Everyone must get health care. Single payer does not guarantee a right to health care. However, here in America, because of the free enterprise system, the best health care in the world can be found. Solutions. I'm big on solutions. Rather than just stating the problem, let's look at some possible solutions. The American people taking personal responsibility for their own health care. Medicine that is free of government intrusion and protects the sacred bond between doctor and patient. Eliminate third-party payers. This is key. We got to get the government out of it. And get your company out of it. Why is Costco and IKEA so popular? Their business model is very simple. Eliminate the overhead and profit of a third party. No warehousing and distribution costs. The product goes direct from the manufacturer to the stores. Something to think about. Salaries of CEOs of 5 health insurance companies. Between the 5 of them, they make $94,700,000 a year. Now, that's before stock options and bonuses and all of the infrastructure of the insurance, the buildings, the office furniture, the employees. That's before all of that, this huge cost. So some would argue, well, that's why we should have socialized medicine, because if we give it all to the government, we will get rid of all these costs. No, you won't. All you're doing is replacing one huge bureaucracy with another huge bureaucracy. The difference is today you can pick and choose insurance companies. They compete for your business. With socialized medicine, you have no choice. You will take whatever the bureaucracy gives you or you will get nothing. And when's the last time anybody was able to fire a government bureaucrat? Question. When you put gas in your car, you fully expect to pay. When you have a meal in a restaurant, you fully expect to pay. When you go to Costco, you fully expect to pay. Why is it that when you go to a doctor or hospital, you expect someone else to pay? Why is that? So what, if anything, should the government do? If at all possible, we need our government to adhere to the KISS principle. Keep it simple, stupid. Good luck with that one. Simply put, only 3 things are required. Just three things. I could write the healthcare law on one piece of paper. 1. True house saving accounts. Money put into an account for payment of medical expenses and only medical expenses. No taxes at all, not even payroll tax. 2. True catastrophic health insurance. Insurance that covers only major illnesses. For example, cancer, heart attack, stroke. 3. All medical expenses taking off the top of your income. And this is very important. Let's discuss this for a minute. Today, before you can deduct 1 penny, you must spend 10% of your adjusted gross income on medical before you can deduct a penny. So that means if you make $50,000, if your adjusted gross income is $50,000 a year, you got to spend $5,000 on medical if you can deduct a penny. However, let's say you own a Roto-Rooter franchise and you send one of your employees to take the truck down to the car wash to get it washed and cleaned. Every single penny of that cost comes right off the top of the business's income. Why? Because it's the cost of doing business. Well, ladies and gentlemen, most of us do business with our bodies and minds. So if we are unhealthy, we can't do business. Therefore, every single we spend keeping ourselves healthy should come right off the top of our income. No taxes at all, not even payroll taxes, none. Just like corporations. The key, the HSA and the catastrophic insurance policy belong to the patient. The patient is in charge. If the patient changes jobs, the HSA and insurance policy goes with them. Pre-existing conditions are no longer an issue. How do we realistically end up with a workable solution? Obviously, change will not happen overnight. People like myself who have been forced into the Medicare and do not have time to build an HSA have to stay on the old system. The new system would have to be phased in over time. As a nation, the following question has to be answered. Is it the job of the federal government or government at any level to ensure every American has health insurance? Is that the government's job? No solution is possible until that question is answered. If the answer is yes, be prepared to turn over your decisions on your health care to the same people who run the post office.
Attention.
TSA.
Attention.
IRS.
Attention.
DMV.
Attention.
Because after all, ladies and gentlemen, a bureaucrat is a bureaucrat is a bureaucrat.
Attention.
If the answer is no, be prepared to take personal responsibility for your own health care. In other words, freedom. Free to choose your doctor, your health plan. Remember, socialized medicine equals all control of your medical care in the hands of a government bureaucrat. You have absolutely no choices. You are, in fact, property of the state. The state. The state. The state. There is a saying as old as time itself, and is just as true today as it was in medieval times. He who pays the piper calls the tune. So what can I do about it? Stay informed. Get involved. Work for the candidate of your choice. If you want to change the law, change the people who make the law. The American people have voted away their freedoms in exchange for the promise of free medical. It only took 2 generations from what is commonly called the greatest generation. Ladies and gentlemen, if there has ever been a clearer picture of how many freedoms you will lose and how fast you will lose those freedoms, all you have to do is look what the government has done with the coronavirus. They dictate where you can go, when you can go, what you have to wear, what you can buy, what you can't buy. You are completely controlled by the government, and they are using emergency powers based on a coronavirus. This is a snapshot of what socialized medicine looks like. Please pay attention. Stay informed. Get involved. Work for the candidate of your choice. If you want to change the law, change the people who make the law. Thank you for your time.